So I had a horrible pregnancy, frequent, constant vomiting. I also had pelvic separation and sciatica. I wasn't even that far along, and I started experiencing nausea, and I was like, yeah, everyone tells you morning sickness is normal. And so I was like, yeah, whatever. And then it was all day, nonstop vomiting. Couldn't stop, couldn't keep water down. And then it turned into me literally just crawling from bed to the toilet and for days. And then at one point started to run a fever and had to go to the emergency room because I thought maybe this is ectopic, which is why I'm experiencing all these horrible flu-like symptoms. And they were like, well, let's check it out, right? They looked at it and they were just like, you just have hyperemesis. And I was like, okay, what's that? And they're like, frequent vomiting, unexplainably, during pregnancy. They then told me, but hyperemesis is totally normal. And I was like, is it? Because I feel like nobody told me about it. So anyway, did a lot of things, made a lot of changes in my life to help alleviate the stress. Things like I ate a really awesome diet and, lots of it because I was throwing most of it up.
Yeah.
Really, really trying my hardest. I also did lots of supplements. I did lots of, I made my own herbal teas with my mom who's a botanist. And so we made all of the stuff and did all of the things. And still just the worst pregnancy and not great for him. I also got kidney stones when I was pregnant, which I thought I was going to labor. And I was 24 weeks pregnant. And they were like, okay, well, if you are in labor, when I got to the emergency room, they were like, if you are in labor, you're 24 weeks pregnant, which means you have just hit viability for a live birth. So tiny. He'd have been like 2 pounds, and maybe. And they were like, yeah, so we're going to move you upstairs to our emergency triage for pregnant women. And so they were like, all right, let's figure out what's going on with you. And they were like, we can tell that there is contracting, but it's not contractions. But we can tell that you're definitely in a lot of pain, but we don't think this is labor. You're not dilated, you still have your mucus plug, he seems like he's good in there. Everything's fine. And they were like, do you drink a lot of water? And I was like, yes, nonstop, all the time, because I throw it up. And I was like, and I'm just pounding it constantly because I throw half of it up all the time. And they were like, okay, well, let's get a urine sample. And they were looking at it we think you have kidney stones. They were like, cool, there's nothing you can do but pass them. And I was like, so if I'm drinking, how did this happen? Because I was upset because I'm like, look, I'm dieting. I am chugging water constantly. I eat so many greens. I'm constantly food group planning. I take all of my supplements, and is there a supplement I'm taking that could have made this happen? And they were like, no. None of the things that you were taking or doing would make this happen. So what we're going to tell you is that obviously what you've told us is a lie, and you need to stop eating salt. And I was like, I did when I got pregnant. And they were like, okay. They also did a full panel to test my kidneys, and they could see absolutely nothing wrong with them when they did a kidney panel. Nothing. All of my results were normal. Why do I have kidney stones? They don't know. And they just assumed that I was lying to them about my diet, my lifestyle. And then when I did go into labor, I'd read a ton of books. We were going to do it the Bradley way, and I wanted to have a home birth because COVID was at peak COVID time, and because it was May of 2020. And I was like, no way, because they were like, you can't have anybody with you. We're going to make all the decisions for you, and we're going to blame COVID if anything goes wrong. And I was like, not going to happen. I labored I had 8 hours of pushing labor, and my midwife was like, he's head down. I can see his head. This is going to be an exit push. Squatting down, ready for an exit push, and then something goes horribly wrong. He had flipped. You could see it because there was no more waters, and you can see him push out of me, like in my stomach, alien, and come up. I ended up needing an emergency C-section. And so when I got to the hospital, obviously an emergency, screaming, freaking out, They give me an epidural, which I never wanted. And I was in the middle of a contraction, and they were like, just breathe through it. We're going to put the epidural in anyway. I was very upset about. But I didn't really have a say at that point. And so we were laying down, they put up the sheet, whatever, and he's born. And when you have a C-section, or even when you have your baby, I'm sure, you know, you can't feel when they cut the cord, but you can tell. There's something about your body where it's just, you know that your baby is not in you anymore. And I could tell that they had cut the cord, but there wasn't any sound. And so I was worried because my baby wasn't crying. And it turns out that he wasn't fine. He was dead when he was born. He was born dead. He had to be revived. So I was like, oh my gosh, like, I want to see my baby then. And they were like, no, which was very upsetting for me. Because no one ever told me, no doctor or anybody told me. It was my mom who told me that my baby had to be revived. And it was on his medical paperwork that he had to be revived. But when I asked about it, nobody told me. What they thought had happened was that, you know, my midwife, who was doing my home birth, was incompetent. And when she had made her official medical report saying there wasn't any meconium in the water, it's the baby's first poop, there wasn't any in the water, they thought she lied. Even though there wasn't any distress in my pregnancy before that point, why would she lie about it? Or distress in my labor at that point, you know, there was no need for her to lie about it, you know, and she had already submitted that officially long before I went to the emergency room. And so, yeah, it was just like, they thought that my midwife was incompetent and that she obviously had to lie. And, you know, they took my son from me and kept him in the NICU for 4 days for no reason, because they believed that in some way I was stupid for having tried to have a home birth. And they told me that to my face. And that, you know, obviously I have no idea what I'm doing. And which does not instill confidence in a woman who's never had a baby before and now has to take one home. And then they were like, you know, we're going to hold on to him just a little bit longer. And part of me, which is really messed up, was relieved that they were going to hold on to my child for a little bit longer, because they made me believe that I couldn't take care of a baby. And that in some way I was going to mess up so horribly that he would have to go back to the NICU. And then they would have to feel the guilt of having let me take my child home too soon. Even though he was on room air the same day he was born. They insisted on formula feeding him even though I wanted to breastfeed him. And they kept scheduling him for circumcision, even though I was like, his labor and delivery and everything was really traumatic, I don't want to get him circumcised. They were like, well, Dad's not here telling us no, so we want to schedule him for a circumcision. So it kept coming up on his like little baby board in the NICU to schedule his circumcision, and I was like, he's not gonna get circumcised. And they were like, hey, little white babies get circumcised, and I was like, no. So, you know, it was a whole mess. And luckily, when I held him and everything, he seemed fine. And when I started working here, I realized there could be something horribly, horribly wrong with his nervous system. He could be really, really damaged in a way that we haven't seen the result of yet. And so I was like, okay, we have to get him in here to get adjusted, because I know that his labor and delivery was so traumatic, and we're so blessed that we haven't had any symptoms yet, but we will if we don't get him in now as soon as possible. Because, and I remember expressing that to Dr. Phil too, like, hey, my son seems fine, and you'll meet him and you'll be like, he's fine. And I was like, but this is what happened when he was born, and I want him to be fine for the rest of his life. And so when I brought him in, you know, I remember my husband being like, why, he's fine. And I was like, because it doesn't always show up as a symptom. which is what he was looking for with symptoms. It doesn't always show up as a symptom right away. Sometimes it shows up when they're older, as in, like chronic headaches or submuconic ear infections or depression, anxiety, and difficulty sleeping. All those kinds of things could come up all of a sudden, and we'd be sitting around like, why? And I was like, why force my child to experience that before I help him? To me, it made perfect sense because I want to give my child everything that they need now so that their life in the future is easy. He came in, he got checked, he's subluxated, like he gets adjusted now every week, and it really puts my mind at ease. Like, as moms, we are always like told what to do, and there is 100% a natural instinct to do what is best for your child, no matter what that feels like to you. Always, always listen to that instinct. Do not ever turn away from that. No matter how much they discourage you, no matter how many times they tell you that you're just being difficult, or that, you're making it up, or you just need to drink more water, eat less salt, like whatever it is, find an answer for it that feels right to you, that makes sense for you and your children, that gives you the answers you're looking for, and that can yield some results to give your children like the best possible life that they could ever lead.